All right, welcome back. You're looking live right now at the D.C. Mayor Muriel Bowser, getting ready to give us an update on the situation here in Washington, D.C. when it comes to the reopening, all the reopenings, all the rules and regulations when it comes to whether these restaurants, how they can deal with dining inside and outside, how everything's going on, the numbers with COVID-19, just everything that has to do with what's going on in Washington, D.C. So we're waiting on the mayor to start talking here. She just walked up to the and sat down to the podium. In the meantime, we want to tell you she's not speaking just yet, so I was going to give you some of these numbers, but I think she's getting ready to speak right now. So I'm going to pause and I'm going to give the mayor the floor right now and just pause and wait for her to start talking and get an update on everything that's going on in Washington, D.C.
Good morning. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and I want to start today by providing a brief update on our new hospital agreements and their status at the D.C. Council. And I want to invite people to participate this evening. We will host a community telephone town hall to discuss these agreements, the details of these agreements, and I will be joined by the city administrator as well as representatives from Howard University and GW. I encourage any resident who is interested in this topic, health equity and a more equitable and healthy DC, to please dial into that call. You may do so by dialing 844-881-1314, and that's tonight, this evening at 5 p.m. And I want to remind you that we talked in an earlier briefing where we invited GW and Howard University and Adventist Healthcare to talk about the district's investments, not just in 2 new hospitals, but in a system of care that will make access to health care easier and more broadly distributed in our city. What we know from our experience with COVID-19 is that health disparities are stark and that we need to make every investment that we can and get everything out of all parts of our government to ensure that we have more healthy people and more equitable outcomes in Washington, D.C. So with that, I'd like the city administrator to talk a bit about the agreements that are at the council. We can go back to slide 3 and also ask you to call us in this evening if you have any questions or want to share any thoughts.
Thank you, Madam Mayor. If we could just go back one slide, please. So there are 2 sets of agreements or 2 pieces of legislation at the council. One would effectuate the project with GW Health at what we're calling the GW Health Hospital to be located on the campus of St. Elizabeth's. Again, that project is a 136-bed inpatient facility at St. Elizabeth's East with the addition of a verified trauma center. The verified trauma center really will allow patients, about 90% of the emergent cases that occur in Ward 7 and 8 to be treated at this new hospital. So the inpatient facility is a community hospital, but has a more enhanced emergency room facility to be able to treat the vast majority of cases that would present. The project also includes an ambulatory center also on the campus of St. Elizabeth's. This is a facility that will have not only a clinic, but be able to do a number of outpatient and specialized procedures at that site, and will be connected to the inpatient facility at St. Elizabeth's. And also, and lastly, the project includes the provision for 2 new urgent care facilities, one to be located in Ward 7, the other to be in Ward 8. The urgent care facilities actually would precede the construction of the inpatient tower and the ambulatory center. We would expect those urgent care facilities to be open in calendar year 2021 and calendar year 2022. The second project that is before the council would support the development of a new hospital on the campus of Howard University and replace the existing Howard University Hospital. That project would be a 225-bed level 1 academic research teaching hospital to be located again on the campus of Howard University. And we also will be supporting and partnering with Howard through DC Health to create 5 centers of excellence that really focus on health services and health disparities that impact our community. So sickle cell treatment, for example, mental health treatment, trauma, oral health. Those are some of the centers of excellence that we'll be focusing on, where Howard can offer a new set of services to the community. So as the mayor mentioned, next slide, there are agreements currently at the council. Just in terms of the timeline, in April, the mayor announced these new agreements for the hospital at Howard University and the hospital at St. Elizabeth's. On June the 9th, the mayor submitted those agreements to the DC Council. There is a hearing scheduled on June 30th and a joint hearing with the Committee on Health and the Committee on Business and Economic Development. And depending on the results of the committee hearing, the first vote of the council would be on July the 7th. And then if the council approves these agreements by the end of July, then we can begin the process to build the new hospital at St. Elizabeth's immediately. You can see on the bottom slide is our timeline for the development of the project at St. Elizabeth's. So in the fall, pending council approval this summer, we would be in a position to contract with an architect for the design of the hospital and the ambulatory center, with the construction contracts being released in the summer of 2021, breaking ground on the new hospital in early 2022, with the ambulatory surgical center opening in the fall of 23 and the new hospital on the campus of St. Elizabeth's opening in 2024. So we think there's urgency, as the mayor talked about at the outset of her comments. There's urgency in moving forward with these projects so that we can have a healthcare system that really can service the needs of all of our residents, address the health disparities that we are seeing, and makes us and our community more resilient for the future. So with that, Mayor, I turn it back over to you. Thank you.
Thank you, CA, and thanks for your hard work on all of these issues, and Deputy Mayor Turnage and Dr. Nesbitt and all the people who have been involved in these discussions. And I look forward to working with the council, answering any and all of their questions, and urging them very strongly to move through their process so that we can begin the contracting process to get the ambulatory care centers built and the hospitals built. So next, I just want to switch to our update on the district's response to COVID-19, and we will go over the guidelines and the guidance that we will make available so our community can start thinking about what phase 2 of reopening looks like and get prepared. This morning, we announced 29 new confirmed cases of COVID-19, which means more than 9,800 people have tested positive with COVID-19 in the district. And sadly, 3 Washingtonians have lost their lives in our report today, meaning bringing our total number of Washingtonians who have succumbed to the virus to more than 520 people. We also announced, and it's reflected in this graph, that we have achieved 13 days of sustained decline in community spread. You will recall the metrics that we are monitoring for our phased progression to get into phase 2, and so we will continue to monitor these data points as we move forward. You will notice, as I just mentioned, that we are trending in the right direction in each of these. Community spread at 13 days, low transmission rate we have achieved, positivity rate we have achieved. Also, for sufficient health care capacity we have achieved, and we are trending in the right direction for contact tracing. I'll just pause on that note because that number you see refers to a 7-day average through 6/14, and I'll ask Dr. Nesbitt to talk about our experience over the last couple of days, which gives us confidence in saying that we're going to hit where we need to be.
Sure. One of the things that I wanted to be able to communicate is that in the past week or so, we've been migrating our data to a new system, and we've tasked the 200 to 300 individuals who are now working with us for contact tracing. 200 of them are fully deployed. 100 new individuals started with us this week in their training, and we'll be onboarding new 60 to 100 individuals next week for contact tracing. What we have is we've migrated to a new system, and now that we have a more robust workforce, we've been reaching out to individuals who were previously diagnosed to better understand where they are in their recovery and isolation. Many of them have worked with our team in the past. Many of the patients, or residents have worked with our team in the past or have been recovered by their healthcare provider, but we wanted to do a much better job of improving documentation of the individuals who are recovered. In the past couple of days, we've been able to have more of a structured focus on our new cases and improved documentation in our new technology system, which we went over in depth with you all last week. So as the mayor has mentioned, in the past 2 days, we have achieved over this 90%, 92% of making first attempts with our new positive cases within 1 day of us being notified of their case. So we calculate this metric on a 7-day average. So because of the back work that we were doing, it's not a backlog per se. So people had been reached out to if they were in that, what we were doing in phase 1, a lot more of those high priority cases. But now that we are reaching out to all new positive cases, a lot more legwork had to be done. So now we're in a much better position moving forward to contact people within 1 day of us being notified, as evidenced by our ability to have in the past 2 days. So this metric will improve markedly over the next couple of days, and we expect it to be able to be sustained over 90% in the next week or so. And we'll continue to monitor it as we move through the various phases of reopening.
Thank you, Dr. Nesbitt. And let me also remind people that if they need a test, to get a test through your provider, your doctor, or the healthcare center that you use, or you can use one of the district-supported sites at the drive-in or walk-up sites, or at one of the district's fire stations that we are using, although I don't see those here on this slide. I'm sorry? The weather. Okay. So these are just the two we're going to use today? Okay. So we are, for today, we'll be using the 2 drive-up sites. All of the testing is done outside, and so rain can hamper our ability to test. So these are the locations on F Street and on Martin Luther King Avenue Southeast that will be available today. So now let's move to our discussion about phase 2. And as I said just a moment ago, we're going to continue to monitor the data. We are trending in the right direction. But today we want to provide the guidelines so that all residents and businesses can be preparing for phase 2. These guidelines will be converted into a mayor's order, and I expect that if we continue to trend this way, I will make these guidelines in phase 2 effective this Monday. So here are the guidelines. First, district government will continue to operate in a modified telework posture. Now, there are some exceptions to that, and I want to go through those, and CA, feel free to jump in. And this, we continue to have more than half of our employees who will be teleworking. The DMV will be an exception, and on Tuesday, we will open up the Department of Motor Vehicles for in-person service. DPR will also be an exception. We will open up playgrounds and fields for use with some very specific guidelines that have to be followed. We also expect libraries to be able to slowly reopen for in-person visitation at various libraries. Some of our OSSI staff will be reporting at their work sites to support child care centers. Our Office of Neighborhood Safety and Engagement will also begin reporting in person, and there will be others, directors who will re-engage various services at their departments and that require in-person work. So our employees will be notified, and we will get additional information out to you. On mass gatherings, the number of people that can gather has been increased to 50 people. More than 50 people are prohibited. On non-essential businesses, and especially retailers, non-essential retail businesses, in addition to the curbside that they have been permitted, they now may have inside, patrons and customers inside at 50% capacity. For personal services, we continue to require appointments and stations to be 6 feet apart, but other personal services like tanning, tattoo, waxing, threading, cryotherapy, facials, and nail salons may now open. Restaurants are permitted to have indoor dining at 50% capacity, which is the big change. Fitness and recreation, gyms and health clubs, yoga, dance, and workout studios may open with a capacity limit of 5 people per 1,000 square feet, and classes must also be limited with a 10-foot distance between patrons. DPR pools may open for structured activities, including lessons in lap swimming, which is distinct from open swimming. And so I've asked the CA and DPR to devise a plan on what that might look like for swim lessons for people of all ages and for lap swimming. We expect to be able to have a plan to discuss with the public by mid to late July. Playgrounds, courts, and fields will be open for casual play on the fields. We will not be permitting league sports, and low to moderate contact sports will be allowed for casual play. And there are specific guidelines at the Department of Health that relate to that. For houses of worship, we are permitting indoor service, though we encourage virtual services to continue. There will be a 100-person or 50% of capacity limit, whichever is less. So not more than 100 people. And we are encouraging that no choirs or singing or shared items be used at those services. Camps and educational opportunities. Camps may open with no more than 10 people in a cohort and with social distancing protocols and other safeguards. Libraries may operate at 50% capacity. Colleges and universities can open when they have submitted a plan to the Office of Planning that has been developed in consultation with the DME and the Department of Health. Theaters, cinemas, and entertainment venues continue to be closed. However, we will open up a waiver process to consider operations at venue-specific request. Those are the big items. Again, Dr. Nesbitt, if you could just mention some of the guidelines that DC Health is putting on the coronavirus.dc.gov website that explains these guidelines.
Sure. Similar to phase one, we have worked on a comprehensive set of guidance documents, well over a dozen, that specifies what members of the general public as well as businesses that are part of the phase two reopening can do to help ensure that we have as safe as possible a successful phase two reopening. What people can expect in those guidance documents is good structured information for members of the general public, employees, and employers who are impacted by the newer guidelines for a phase two reopening. Each guidance document will provide instructions for the employees, the employers, information in terms of if your facility has been closed, things that we want you to do to prepare the building, including for the water, for example, that has been shut off that may present additional public health challenges that are not related to COVID. We also have included, based on feedback that we received during phase one, what employers should expect to do in terms of communicating to us. Employers or business operators should expect to do in terms of communicating to DC Health if an employee or a patron of their business contacts them and informs them that they have been diagnosed with COVID-19, how they communicate that information to DC Health, and what they should expect in terms of a response time for DC Health if they have submitted such a correspondence or inquiry. That will help them get a little bit more insight in terms of a response time. For certain sectors who have a substantial or a different change in operations, based on the guidance document, we will be hosting webinars for them to be able to ask questions of the public health professionals at DC Health to help them understand how to make these social distancing changes or sanitation and hygiene adaptations to their business operations. And these webinars, we expect to have them recorded and also made available on the phase two reopening site on the coronavirus.dc.gov phase two site that is posted there or for future reference. So we're all working collaboratively and collectively to ensure a successful transition into the next phase of reopening in the District of Columbia, and hope that everyone will review the guidance documents, those for the general public, those for families with children, those for who are members of vulnerable populations. There's a guidance document for everyone. Thank you, Madam Mayor.
Thank you. So go to coronavirus.dc.gov/phase 2 to review the guidance, and we can begin our phase reopening, we think, if our trends continue on this Monday. Yes. Yes.
Morning, Mayor.
Good morning.
Question about contact tracing.
Sure.
In New York City, Mayor de Blasio has apparently instructed contract tracers to not ask individuals if they had attended any of the social justice demonstrations over the past couple of weeks. Is that a directive being put into place here in the district? And if not, why?
Dr. Nesbitt will know a little bit more about the interview.
So we conduct a comprehensive interview. We ask questions about the individual's movement, all of their activities, and we ask questions in a non-judgmental way. It's important for us to know where an individual has been to be able to identify their risk of exposure. What we have communicated publicly and will continue to communicate publicly is that these First Amendment demonstrations are mass gatherings, and that is how we have viewed them from a public health perspective. We hold no judgment against any type of public First Amendment demonstration, where it was held, the specific location, because we recognize that many of the people did converge in a specific location. Our primary interest is knowing where the individual's movements were so that we may be able to identify a specific location where they may have come into contact with other people and there may be a single source of exposure. I would caution against communicating to people that there may be some type of activity that they participated in, that it is appropriate to withhold that activity from a public health authority that could cause stigma from that activity. If it is perceived that a First Amendment activity has a set of stigma, then individuals might start to assume that sexual intercourse that has stigma and should be withheld, or going to a brothel is a type of activity that should be withheld, or going to a spa that should be closed but is open is a type of activity that should be withheld. We need people to be very transparent with us with all of the activities that they are participating in, so we can identify sources of exposure and limit that exposure from other people, so that we can really do a good job of preventing transmission in our city.
Could I follow?
Yes.
Because I ask that not in a judgmental way, I ask that in a clinical way if you're trying to conduct medical research here. I think the layperson would suggest that there is a difference between an individual having sexual intercourse and participating in a demonstration, which many of us were at, with tens of thousands of people. Is this a question that is going to be asked, not judgmental, but in a clinical sense? The information that you
I answered you in a very clinical way. We don't ask people, did you go to, is not the question that we ask. We ask people to give us a history of their past activities. If someone does not tell us that they went to a First Amendment activity, we don't proactively ask them if they did so. So I want to make sure that that is very clear. What we are trying to do is we're trying to ascertain people's movements to be able to identify if there is a particular source of exposure, to proactively discourage people from disclosing types of activities or places that they have gone to could give people the impression that there is a stigma around participating in a particular type of activity, and could encourage people to proactively start withholding types of activities from us. And that it does a great disservice to the process of disease investigation and surveillance.
So the message here is to anybody who comes in contact with a contact tracer is to be an open and honest.
Full disclosure, absolutely.
Yes, Mark.
A couple of questions. One on the entertainment venues and cinemas asking for a waiver. I'm guessing, like the farmers market, they'll have to produce some type of a safety plan that would be approved.
Yes.
You said with churches, no choirs, I believe. Is that correct? So I'm wondering, is live music allowed under Phase 2 at entertainment venues?
It would have to be waived. It would have to be a waived activity.
Live music.
It's possible with the approval of a waiver.
And then when you talked about swimming pools and DPR pools being open for restricted purposes, what about communal pools at condominiums, apartment buildings, private pools like that?
I think where we've landed on residential pools, Let me just confirm, because we had a lot of discussion about that. Let me confirm that, Mark.
If I could ask about the metrics, and specifically, I know you were trending in the right direction, and you hope by Monday we'll be okay to move forward with phase 2. Is it simply the contact tracing that is really the one thing that is lagging behind here?
It's the one thing that we have not met, and I think also the community spread. I think we have another day to achieve. I didn't hear you, Mark.
The community spreads at 13 today.
Yes.
So you got one more day to be there. But
Yes.
The bigger deficit is in the contact tracing.
Yes.
Is that correct? So if
And the only reason we call it a deficit is largely because we haven't been able to watch it long enough. And our expectation if the last 2 days is an indicator, then we will be able to meet it. Even though we don't have, the way that DC Health is reporting it is with the previous 7 days.
that's what I guess I'm having a hard time understanding, or I guess I'm confused about, because
All right, Washington, D.C. Mayor Muriel Bowser giving us an update on the situation in Washington, D.C. She says there have been 13 days of sustained decline in this spread, which is actually a good thing, and they want to keep that going. If this trend continues, the mayor says that on Monday they can go ahead with phase 2 of the reopening in Washington, D.C. There's a lot of information here, so a lot of that information you're going to have to get from our website. I'm going to try to hit a couple of hot spots here. Some of the phase 2 guidelines that will happen on Monday if we continue moving in the right direction. The D.C. government will remain on modified telework. More than half of the employees are already doing that. On Tuesday, they plan to open a DMV locations for in-person service. Playgrounds and fields will be open with some guidelines as well, as so will libraries. 50 people will be the limit for the mass gatherings. This is all part of phase 2. Churches will be allowed to have indoor service, but only 50% capacity, or 100 people, whichever is less. Non-essential retail can now have people inside the stores. 50% is the maximum there, 50% capacity. Restaurants can also do indoor dining, 50%. You'll hear that number a lot, 50% capacity. Gyms and fitness centers will be able to open and have people inside, but there will be limitations there as well. Limitations on pools that they will have that will reopen in regards to swimming in certain lanes and lessons only. There will be no free swimming. Playgrounds and courts, I mentioned that earlier. Fields will be open for casual play, but there will be no league play at this point. You won't be able to go there and continue with your leagues or start your leagues because nobody's been playing, but you will be able to go there for some workouts and some other things if you want to. Again, a lot of information to unpack here, and there's a lot more details in regards to a bigger picture when she started talking about the hospitals. We'll give you that information on our website. You can continue to listen here, but we'll give you information on the website. You can also tune into our shows this afternoon as well to get the latest information on COVID-19 here in the DMV. So again, D.C. Mayor Muriel Bowser giving us an update saying that hopefully we will be able to move into phase 2 in Washington, D.C. by Monday if all things keep trending in this direction. So that's the latest information. We appreciate your time. Thank you for hanging with us through this morning. Keep watching Fox 5. You can tune in to fox5dc.com for more information and also watch the news this afternoon starting at 4.